You're still watching TVC Breakfast. We now talk about this very, very important conversation. Now, misinformation and misconceptions about snake bites are putting lives at risk in Nigeria. It is time to set the record straight and debunk common myths that are causing harm. One of the most common myths is that sucking out venom or applying a tourniquet can save a life. This is simply not true. These methods are ineffective and can cause more harm, leading to serious complications or even death. Another myth is that traditional remedies such as herbal concoctions or charms can cure snake bites. These methods have no scientific base and can delay proper treatment. The truth is that antivenom administered by trained medical professionals is the only effective treatment for snake bites. It's crucial that Nigerians understand the importance of seeking medical help immediately after a snake bite. Joining us for this discussion is Dr. Tui Mebawandu, a medical doctor. Good morning, sir. Thank you for joining us.
Thank you.
I am very happy to have you on the show this morning for this important conversation. And today I'm going to let you do a lot of talking because you are an expert in this field. Like I just read, oftentimes there are a lot of myths that people have believed in for a very long time. You know, these are things that people know from growing up. You believe that, oh, when a snake bites you, you just put a tourniquet. When a snake bites you, you know, you do something that you're not supposed to do. But now we're seeing medically that these things are actually harmful. The first thing to do when, you know, you're bitten by a snake is to go to a proper medical professional and get an antivenom.
Yeah, exactly. In fact, in the era of social media, most of these negative narrations are on the air, and you see a lot of experts. In fact, in the past few weeks, I've been listening to all sorts of opinions, and I was wondering where all these things are coming from. And we must appreciate the fact that we're a big social influencer, and we must be able to dispense information that can be very useful. Now, let's come to snakebite as an example. You've listed some of those things. I'll go into the details. That one, when there's a snake bite, the most important thing you should do actually is to immobilize the joint, remove all constricting bandages, either shoes, belts, rings, or whatever, remove all those things, and then transport to the hospital ASAP. Now, why is this important? Because one, there are different types of snakes. There are different venoms, which we call envenomation, that are produced by snake, and they have different effects. In fact, one of the most deadly ones are the ones that actually affect the nervous system, or neurotoxic venoms. They go right ahead, you know, the person will start drooping of the eyelid, paralysis, convulsions, and all those things. Before you know it, the venom is going around the whole body, and if you don't transport to the hospital as soon as possible, of course, you may not be able to save the person. Respiratory paralysis will come, the heart will stop, and that's the end of the thing. Some actually, you know, can just cause massive swelling on the leg. That's the toxic one, massive swelling on the leg, and even cause, you know, cutting off of the blood supply to that part of the limbs, and you have to chop off the leg. So we need to understand the dynamics of this snake bite and what it means. Now, why I am glad that we're now putting attention to snake bite. Because it's a neglected tropical disease, you know, including onchocerciasis, including elephantiasis, including trachoma that causes blindness, and even schistosomiasis. Quite a lot of diseases are neglected. Neglected in the sense that it affects mainly the rural poor, okay? No fund, no research, limited medication to deal with snake bite. That is the critical point we are in. So it points, you know, to the asymmetry of power between the poor and the rich, or even the enlightened and the non-enlightened. And we've stuck to that narrative that do this. And of course, the do nots in snakebite are very, very, very clear. And that's what we're doing. You've pointed it out. Don't apply any pressure or tourniquet. Okay. You know, because if you do that, what it means is that the poison will soak into that place and cause more injury. So don't apply tourniquet. Don't put ice pack. You may compromise blood supply to that place you are putting ice pack. Don't put alcohol. Don't put kerosene. You don't need all those things. Don't start. All you have to do, like I said, immobilize, okay, and wait. And then don't cut the wound and start sucking it out. You will not get any result. Now, there's a difference between what is scientifically proven and the myth we hold in our head and we cannot let go because we are not having a different narration. And it points to the fact that we're not discussing, we're not interacting with people sufficiently to let them understand what it means. And one of the cheapest things we have, the lowest hanging fruit, is to talk and dispense appropriate information concerning this neglected thing. Right. Now, the other aspect of snake bite is simply this. It is a complex intersection between human, animal, and environment. Okay? Now, the concept of One Health means that in an environment, we see interaction between human and animal. We are encroaching on the natural habitat of the snake, because when you see snakes in the house, they're either seeking for food, warmth, or safety. Simple. Okay? And then, because we're encroaching on the environment, they also try to look for where to hide and look for food. That's why when they're looking for rats or something like that inside the house, anything to eat in the house. So, and then accidentally we got bitten. I don't think snakes, except those ones that actually constrict and swallow human being whole, snakes don't actually really target you to be bitten. I don't think it happens, but we meet them. So now, it can't be one solution. I saw a lot of bashing of health system. You know, it happened during Joshua's accident. It happened when that beautiful lady lost the son. Now it's happening during the snake bite again. So snake issue is not just about health. Health alone will not solve the problem. The health aspect of it has to do with the supply of the vaccines, transportation, logistics, and that's where it ends. Okay, but agricultural practice. The way you construct your home, housing policies, okay, government intervention on how to respond to emergencies as it is, food safety mechanisms, because people affected are actually rural, poor people, disadvantaged, no access to health, no transportation. These are the critical things we have to discuss between the veterinarian, agricultural practice, housing people, housing methodology, or housing policy. All these things have to work together to drive attention to reduction of snake, because we know very well that as much as a snake, every 5 minutes somebody dies from snake bite worldwide. That's a lot of number, 130-something thousand. In Nigeria, 15 to 20,000 bites, we lose 2,000 people every year. But as small as difficult may appear, but you can see the traction is bringing to everybody, showing the ignorance of people that are supposed to know, showing the confusion and what chaos it can cause. Some people are saying that, Nigeria is finished. How can somebody die of snake? Snake bite is not more money to use the street parlance, because the toxin, unfortunately for the talented lady, may her soul rest in peace, she encountered one of the worst envenomation, So, and then for us, at the site, we must be able to recognize what to do. Even at the site, first of all, ensure that we don't have increased snake bite, a repeat snake bite, or multiple casualty. Many people have been bitten by that snake. Just ensure that. If you can identify the snake, nice, identify the snake. The next thing is that look out. If you see the person convulsing, it's a neurotoxic snake. If you see the place swollen, it's a cytotoxic case, pain and swelling. Then if you see the person having bleeding from any of the orifices, know that the snake has gone into the blood and destroyed the blood system. It can cause massive coagulation in the whole system and just stop the heart.
Absolutely. Dr. Tuyi, I'm very, very glad that you're here, because I believe this is a very teachable moment. We all need to unlearn and relearn what we think is the first line of treatment for snake bites. It's sad to see what happened to that young girl, but unfortunately, her herself believed that a tourniquet was the first line of treatment. We heard that is what she did to herself. But I want to ask this. From your experience, you've mentioned some very dangerous, mindsets that people have around snake bites. And you said that the first thing we should do is take off rings, take off restriction. But assuming somebody finds themselves, unfortunately, God forbid, in a situation whereby they can't get to a hospital, what is the next step for them? We now know that, luckily, thank God, the Senate has boots on ground. They said that antivenoms must be stocked in every hospital, and they've given that directive. People are now going out, I've seen online, to buy antivenom and stock it in their houses. Assuming you can't get to a hospital, well, what do you say to these things that are happening, that people are now taking laws into their own hands?
Indeed, let's be factual. It may be difficult for you to get to your hospital depending on where you are. And like I mentioned earlier, most of the population affected by snake bites are actually rural people that may not even have access to the hospital. That's right. So what we need to do, like I said, in the concept of One Health, is to integrate the education from agricultural people, from the veterinarian, from the housing policies, because if you build a house and you are storing your grain there and rat is looking for your grain and snake is looking for rat, you're going to attract. So now if you cannot get to the hospital, the best thing actually is that you have to wait and watch and call. Because I don't know, you cannot tourniquet, okay? You don't have anti-snake venom. What else are you supposed to do, okay? And that is the reality of our health system, that we need to do more in terms of the primary healthcare system. And then people that are buying anti-snake venom, anti-snake venom are not just Panadol, they're not just paracetamol, let me put it away. It has expiry date, it has reactions, okay? One of the dangerous reactions, what we call anaphylactic reaction, your body will just react to it in an abnormal way, and then you can't be saved. So there's no point buying anti-snake venom. The key thing is to actually structure your environment to prevent snake bite. Light your compound very well. Avoid open defecation, going to the night to pee or walk at night. Don't walk barefooted. If you have to walk anywhere, wear gloves that can prevent that kind of snake bite and envenomation. I mean, those kind of education will help us to prevent snake bite, because the key thing in snake bite is prevention. Because how many can you really treat, okay? It's prevention. And then, indeed, we need to have a new set of antivenom. But fortunately, there is no research. People don't, because it's not the problem of the West. They don't want to do research on it. So it's your problem. You have to figure out how to get it done. So at the end of the day, we still have to stick to that serious education, because the scenario you painted, no hospital, no nothing. What else can you do?
Right. So, excuse me, the fact that the Senate has now, called on, the national, for a reform to ensure that all hospitals have access to venom, they have it, in store in case some things like that happen. If you go to the farmlands, it happens, several times, and it has been treated somehow back in the day before the emergence of the new science and all of that. I've had an experience growing up where a scorpion, I don't know how intense, how deep, how dangerous a scorpion bite can be, but I know that it is very venomous as well, if you can help me understand that very well. They killed the scorpion, incised the spot where it bit my brother, that's my stepbrother, and then they used the water from the scorpion somehow to kill, and then it didn't feel the pain any longer. People have been treating snake bites, traditionally. So are we saying that the traditional means or method is archaic now and it doesn't work, even though it worked in the past?
That's the interesting thing about science. Let me tell you that there are 4 categories of snake bites. There could be a dry bite. Don't think that every snake bite is venomation. Yeah. There's a dry, there's a minimal envenomation, there's a mild, moderate, and severe envenomation. So it's not, and then quite enough, as much as 40% of snake bites don't even have venom. So now, when you now situate that, and I hear the story, maybe it's working, maybe it could have been working for them, but again, unfortunately, I'm a science person, and I have to really relate to that level. Now, we put evidence on the ground. Do you have leaves that work for snake bite? Okay, let's do envenomation. In fact, in reality, one of the key practices is actually trying to cut the place and suck the thing out. Science did a radioactive thing, tag some fake venom, and do that sucking. You can only get probably 0.04% of the venom out through that process. So why are you adding more injury to the person? And
it's even dangerous for the one who is trying to suck it out.
Exactly.
Yeah, you are sucking it out. So in reality, most of these things we so parroted as wonderful thing may not actually be working. They may be working, but again, let's put this thing to test. But for me, the big issue about snake bite is prevention. It's a one health thing: animal, man, environment. Yeah. Let's deal with that. Once we do that, now Senate is saying that, okay, you know what, everybody's talk this thing. Thank you, Senate. We have a lot of problems with our snake bites. If Senate is going to address the health system, let us address it appropriately. We shouldn't be doing things in silos. Today we're talking about accident, tomorrow we're talking about snake bite, tomorrow we're talking about somebody falling down. That is not the way to address health system. So Senate, they should be able to do better. Now, you have about 33,000 or so primary health care centers all over Nigeria. Maybe 6,000 are working. So, I mean, let's deal with those things. Let's make sure that we raise the number of primary health care centers in Nigeria that are working, that are properly stocked, to maybe more than half, 70%. Then we know that, okay, we have a process. Now, we tend to have a local diary or, a local, enumeration of incidents of snake bite. Rainy season, flooding can actually push snake to your house. And you have to actually do that. I know that in this area, in this middle belt, we have more of cobra and mamba, biting people, because this is the planting season. You have to really do some scientific thinking around that. It's not just you waking up and say that, oh, everybody, stop. Okay, for instance, if I put snake venom in my facility, and in the next 5 years, no snake bite, and I've paid money for that snake venom, who am I going to do with it? I'll just throw it away.
Exactly.
So is there a place where I can return the snake venom to and then collect a fresh one? So the policy is not just saying that, okay, go buy. At the end of the day, somebody wants to whack some money. That is what is going on.
Because of our time, I'll just come with this question. Oftentimes people will say fumigation. We need to also, we're talking about prevention, but they'll tell people don't go out in the night, wear sleepers and all these kind of things. And people were saying that snakes do not climb the bed. I also want to know, where are some of the places that snakes can reach? Or do they climb?
Snake climb trees now.
They climb trees, so they can come on the bed.
Climb trees.
But another thing I want to talk about is fumigation, because someone was saying it the other time that you need to fumigate your compound, you need to fumigate your house. So if these, you fumigate, is it a way of preventing, snakes from coming into your home?
It has to be a different level of fumigation. It's
so what type of
fumigation, actually? I wouldn't be able to say specifically, but I don't really think, because snake is not resident. It's not that snake is, has a hole staying under your house. Something will drag the snake to the house.
Something like, so that's the rats or?
Exactly. Either looking for warmth, looking for safety or food.
Okay.
That is what, and that's why you observe in the villages, snake will crawl and come and snatch your chicken.
Before we go very quickly, Dr. Tuya, I want to really still focus on this line of first aid treatment so that all our audience can learn, including myself. Now, they say the World Health Organization, they said that the first thing to do is to immobilize the limb. And you said that. Can you demonstrate for our audience very briefly, or just tell them briefly the correct way to do that? Because people are saying, I'm not to tourniquet, but I'm to immobilize. What does that look like?
Okay, you know what? Let's say there's a bite on the arm like this, on the hand like this. Let's say you're putting it and there's a bite. Okay, don't just flip the arm around. Someone should put a splint, to make the arm stable and straight.
Keep it straight
That's immobilization. It's so that you don't just have to be swinging the arm anyhow. Okay. That's what if the leg, same thing. That is immobilization.
By sprints, are you referring to?
Yes. You can use it.
Could be anything.
Yeah, it could be stick on your cloth you used to just hold it.
But not tight.
No.
Not tight.
Not tight.
At heart level?
Yeah. Now, depending on the type of the venom.
Yes.
Some people say that if you have neurotoxic venom, you should put at the level of the heart. Okay? But it's neither here nor there. Some say that if you have cytotoxic, put it below the heart. So it's not.
So which one do we really go with?
Immobilize, remove tight bandages, transport to the hospital. What else do you want to go with? Okay?
Exactly.
And then, like I said, issue of snake bite is preventive in nature, and it's no one solution. It's not that you say that, once you have doctors working in this place, they will do. How many things do you want them to really solve? Where they have babies that want to die, when they have cholera, people that are vomiting, where they have Lassa fever. So the thing is that all of us are involved. I mean, I want to challenge them, and I love what you are doing. Honestly, kudos. I want to challenge the media people to actually seek the proper information and disseminate, because you guys have the ears of everybody.
Exactly. We will do that. Thank you so much, Dr. Tui. This was such a very beautiful conversation. I'm sure that our audience have learned a thing or two, from snake bites. Thank you. Thank you so much for joining us.
Handshake across.
Thank you.
Thank you.
All right. Thank you.